All right, we're all talking about ADHD, estrogen, and hormones. Now, in addition to the typical cognitive burden that ADHD can bring, women with ADHD also have to deal with an ever-fluctuating hormone environment their entire life. Now, changes in estrogen can intensify the symptoms of ADHD, particularly during your menses monthly, puberty, and menopause. It's important, my friends, for women diagnosed with ADHD to be aware of how estrogen impacts your life, right? So the brain is one of the organs of the body that targets estrogen, right? And in addition to being one of the main hormones that is responsible for regulating the entire female reproductive system, estrogen is also playing a role in our cognitive function, way more than we would ever believe. Because it modulates serotonin, dopamine, all of our neurotransmitters that helps our mood and our memory. And when estrogen levels are low, you experience increased emotions, moodiness, anxiety, difficulty concentrating, memory problems, and even lack of energy. Thanks. So, women with ADHD can be particularly sensitive to those lower levels of estrogen, particularly with ADHD and the neurotransmitter system within the brain, because estrogen levels also impact the effectiveness of stimulants if you are on stimulants. Now, higher levels of estrogen seem to aid in the effectiveness of ADHD medications, while progesterone seems to actually decrease the effectiveness. So thus, during times when hormone levels change significantly, ADHD medications may be more or less effective to manage those systems. So let's start with puberty. With the onset of puberty, estrogen and progesterone levels can be both increased dramatically. Teenage girls with ADHD may experience intense mood swings and irritability, and notice that their ADHD medications are not working as effectively. Next is PMS. During the menstrual cycle, estrogen and progesterone levels change, and this may play havoc, obviously, with your medications as well. Pregnancy, well, during pregnancy, estrogen levels are much higher. This may help ease ADHD symptoms for women. However, many physicians have their patients stop ADHD medications during pregnancy for any health precautions. Makes sense, right? Now, postpartum. Following birth, estrogen levels drop dramatically and exacerbates ADHD symptoms, and the extra stress of all the baby plus the lack of sleep can further intensify ADHD symptoms significantly. So perimenopause typically depends in our late 30s and mid 40s. And the fluctuating estrogen levels may cause many women diagnosed with ADHD to notice worsening of symptoms. An increase in stimulant medication may also be prescribed to help those fluctuating levels of hormones. Now, menopause usually occurs between 45 and 50 years of age, and it brings a significant drop again in those estrogen levels. However, during menopause, these levels tend to stabilize. So when ADHD symptoms worsen during this time, you may be prescribed hormone replacement versus a stimulant that may be unnecessary. So for women with ADHD, fluctuating hormones is absolutely a thing, and the condition is very challenging. So the interplay between our hormones and medication also is changing. However, these are things that you can do to help during those times when estrogen levels are fluctuating and ADHD is at its height. So work with a functional medicine doctor to find the appropriate medication for you or a psychiatrist, and simplify your daily life as many ways as you possibly can to lower your stress. Of course, get sleep, get regular exercise to instigate those natural endorphins, and just bring better awareness to your doctor on hormones and how it affects estrogen. Now for me, I have tethered my ADHD with supplements all of my life because I have a background in functional medicine. But I will say this, when I turned midlife, that's when I re-diagnosed myself with ADHD and the mask came off. And so I highly recommend finding a functional medicine practitioner. My number one test is the Dutch hormone test, because you're able to see the metabolites that are actually releasing in your urine to determine how you're metabolizing your estrogen and where your levels of progesterone are. I also recommend bioidentical hormones for if you are, able to be prescribed them through a functional medicine or your doctor, because it absolutely takes the edge off. And it also, we have to remember that estrogen will actually save your life. So increase of estrogen when you start to get in your menopausal years is absolutely critical for cognitive health, as well with balanced progesterone, which helps you sleep, and stress, so many things. So this is where I'm gonna cut it off for today. Just wanted to walk through the different, basically, phases of women's life and how estrogen either increases, decline, and then give you a good source for the number one test, which is the Dutch test. Make sure you get tested, don't guess. All my love, all my light.